Hello, this is Michelle Arslan's Week 8 discussion board post on the teaching of the young mother who recently has had a vaginal delivery. Some things that I would establish or try to establish while caring for the patient is to establish a rapport with the patient, to try to gain her trust, and to really delve deeper into the emotional status of that patient. And the reason why I think it's so important to know the person's emotional status, because that definitely could tie into their drug abuse if that is present, because she definitely has drug seeking attributes. But to really see why, is this an ongoing issue? Is the patient depressed? Really, what is going on emotionally with the patient? Because whatever's going on emotionally with the patient is what her outward appearance and expressions will be. Also, what is her coping mechanisms and what support system does she have at home? The video is pretty evident that the new mother has no support at home, but maybe she has some family that we could try to get in contact with to reach out to, or perhaps maybe the father of the baby could be more involved, or is that a toxic relationship? So we really need to decipher and really get into the emotional aspect of that patient and why she prefers Percocet, first and foremost. Secondly, we need to let her know that this is not a judgmental rapport with the patient. We're not going to judge her. We just want to help her and let her know that she's in a safe place and receiving care, and respect her. So, and then once that gets established, then we can say, okay, what type of pain are you having? What symptoms are you having? And we can also teach her about alternative therapies for her pain. So say if the patient did in fact have a vaginal delivery, I'm assuming she had a vaginal delivery in this case, then she will go home with ibuprofen and Tylenol as her use for pain medication. In addition, we could also do other alternatives for pain management, and that could be a Dermaplast spray, ice tuxin spray, like the ice packs, because I'm a labor and delivery nurse, so that's something that we definitely recommend to all of our mothers that are going into postpartum and recovery. And so we would make sure before she heads home that she has the Tux pads, a Dermaplast canister spray, and then also some extra ice packs for her perineum so that she can manage her pain that way, because that will definitely help her out. Also, she can alternate between Tylenol and ibuprofen, intermittently, and then eventually she could start to taper off from that. So I would definitely speak on that. And so those are some of the things that I would teach her on. And then also let her know that one of the side effects of Percocet, which would also be additional pain from Percocet, is the constipation piece. So people are thinking, oh, Percocet's going to take away my pain. But then they need to also be educated that while taking Percocet in the hospital, you need to increase your fiber and your fluids, because Percocet is habit forming and will constipate you. So we need to teach on the drug and then also the side effects. So the takeaway piece that I would do was to establish rapport with the patient, know the emotional well-being of my patient, approach them in a holistic way, and then also assess their pain level. We need to respect our patients no matter what, where they come from, no matter their race, their religion, or their country of origin. We need to respect them as human beings and really approach them in a holistic way. Thank you.